the
Audience.
audience.
Give it a minute. Oh, here we go.
Are we loading up?
Yes. Start.
Buffering. Very long. I'm the favorite. I'm the favorite. I always come under budget. And self-sustaining. I should. Well,
Whenever you're ready, we're ready.
what do I do? Do I just click this thing? Still buffering? I still got to wait. You guys have copies? Do you want me to just go ahead?
Here you go. Really nice, really
Oh,
great.
okay, wait. As soon as it comes up. Oh, there we go. Okay, you're asking me to do something that I, oh, wait, there. I can't see. Okay. You'd think contacts and glasses would be enough.
There you go. Just do the little.
Oh, got that little wheel? Okay. The Recorder's Office is an essential component to the economy because of the importance of timely filings of real estate transactions and record keeping. The last quarter of this year was very slow due to the sluggish real estate market coupled with high interest rates. However, houses are still selling, and we are very hopeful for an upturn in the marketplace this spring. Even though over 60% of our filings happen through electronic submission, real estate brokers, attorneys, banks, and other stakeholders still rely on the abstract companies making that final search in filing the documents that are delivered to our office, and their reliance on our office to get them recorded on the same day. I'd like to take this opportunity to thank the board for always providing me with the resources needed to provide these services to the citizens of Polk County. For each of the last 17 years, we have delivered services while remaining self-sustained. We have always kept within our budget and ended each year under target. I credit my staff for superb customer service and stepping up when needed, none of which could happen without your support, and as always, it is very much appreciated. Our estimated revenue for the 24-25 year is $3,475,000. Our requested expense is $3,302,000, which is $5,000 under target. My prior year expenditures for redaction services and purchases were paid last year, so there's a $59,000 reduction in the expenses. The changes also include personnel services, which obviously is nothing, that's a given. Maintenance agreements increase, boat renewal, miscellaneous expense adjustments because a boat renewal happens every 3 years. Recent accomplishments, there was an increase in handling fees from the Iowa Department of Natural Resources, which is something we didn't even ask for. It went from $1.25 to $2. Woo-hoo. Still,
And the state did that on their own?
they did that on their own, Department of Natural Resources. I do want to give them credit for that. We have been asking for increases every year, but they did this really kind of on their own. We finished position questionnaires and evaluations for the countywide study. We migrated to e-submission 2.0 with Iowa Land Records, Recorder's statewide record system. We started an ongoing project to add older real estate records and images to the current website. Oh, I must have missed this one. The upcoming opportunities and considerations. In the near term, I would like for you to consider the Recorder's Office would like to partner with Project Iowa and hire an intern. Project Iowa is a nonprofit organization that offers support and training services to Iowans seeking better careers and better lives, no matter their circumstances or background. The Recorder's Office does not currently have the funds to support this goal and asks the Board of Supervisors for their consideration in helping with the resources needed to fund this program in our office. In the long term, we are going to do some digitizing of additional archive documents and lobby state legislatures to increase recording and vital copy fees.
Julie, is that Project I, was that the one that the HRs, okay, I'd make sure I
Yes.
get the names right. So
Yes. I think Matt and I talked with
Yeah.
Noth, is that his name? Chris
yeah.
Noth?
Yeah.
And and that is the one that you are familiar with as well.
Yeah, we've got a recommendation in the HR budget, I think it's tomorrow, to provide some funding for some interns.
Okay.
Interns on our own or interns with Project Iowa? What are you talking about there? Interns on our own or with Project Iowa? She's talking about Project Iowa.
Yeah, I think that's the
You put 6 Project Iowa interns in the HR
Budget.
in the package. She's getting one, Mary Wells is getting one, and there would be 4 more for anyone else.
It's through Project Iowa, though, that's your question.
Yeah, right.
Yeah,
Right.
same, it's the book, say, I was just double checking to make sure that's what the HR's proposal is coming through the budget.
The way I understand it is we reimburse Project Iowa. Project Iowa pays the interns, but we reimburse them, is that
That's
correct?
correct.
Last time we did it was like 18,000 for the intern.
I think they had IT had two.
Yes, that's
and-
right.
And it was really successful. They try to hire kids from like east and north, disadvantaged financially, so that they can.
Do they do any training at all? I forget. With
They,
the
they
kids
do,
first?
they do kind of expectations, transportation, how you're gonna get there, what
Okay.
happens to you if you don't show up, and, you know, all
Soft
of
skills,
that.
that kind of
So they-
stuff, right?
Yeah,
They navigate me very closely.
yeah.
Well, in their brochure, it says, "We recruit and train high school seniors and match them with professional work experiences." So they do some training before they, and some vetting before they send them our way.
Do, yeah.
Good. Yeah, Julie runs a great shop over there.
Thank
Okay.
you. Have great staff.
Both Julies. Julie Figgenshoe and you.
Oh, well, I'll thank you thank you from Julie Figgenshoe.
Yeah, we were talking about you.
Hey, I run a pretty great shop, too.
Yes, you do. Yes, you do.
You do a reasonable job.
That was funny. Okay. What's the deal with lobbying state legislators to increase all your fees? That's what you were
The
talking about?
Iowa Association of County Recorders is right now working on lobbying for increase in recording fees. I'm not sure that, I would rather lobby the state for some money from the unfunded mandates that they've given my office.
Wouldn't we all?
Yeah, I just don't know that they see an increase in recording fees as something that's always on the back burner. So I don't know that they're really going after it this year, so we'll see what happens.
Okay.
Any other
Right.
questions?
I don't. Thank you, Julie, for
Uh-huh.
everything you do.
Thank you.
Thanks, Julie.
One's up next. Right there. I think we are. Take off my jingles. There we go. Well, good morning. Helen Eddy, Polk County Health Department, and Mandy Penning, Deputy Director. Thank you. Our estimated revenue for fiscal year 24-25 is $5,023,000, and our requested expense, $9,580,000. Current FTEs, 46 FTEs at the Health Department. I do want to note that we have 44 actual employees, and that number, the 46, includes 2 open grant positions, grant-funded positions. So we have 44 actual employees. Our fiscal year 24-25 revenue estimate is $175,000 over budget. The changes include an emergency preparedness grant increase, primarily driven by that Bridge Access COVID and Flu program. That is a new program from the federal government that allows for the coverage of COVID and flu vaccines for uninsured and underinsured adults. The way to think of that Bridge Access program is like the VFC program that we have for kids that are Medicaid eligible and uninsured. The hope is that that is going to expand beyond flu and COVID and open up the door for covered vaccines of all types for adults in our community. It also includes a $200,000 increase in our HUD lead hazard control grant increase. That HUD grant is our federal grant. That ends in March of 2025, and we do intend to reapply for that federal grant. We have a decrease of $142,000 in grant and donation adjustments, primarily driven by a $90,000 decrease in the Wise Woman grant funding. The state chose not to apply for that federal grant funding this year. That is a program that provides cardiovascular screening service and education services for a subgroup of our women that are receiving services in breast and cervical cancer screening. So that funding is not there and available to us this year.
That state funding or federal funding they chose not to apply for, or what?
Federal funding that they chose not to apply for.
Okay.
And then finally, a decrease in COVID and flu shot revenue. Again, we see that because of a decreasing demand, and also the fact that more and more people are receiving those vaccinations through pharmacies and other providers. Our expense request, changes in personal services, $313,000. Again, an increase in expenses with the emergency preparedness grant. Our HUD-led hazard control grant, increase in that expense, again, partial year for that. We have some miscellaneous grant adjustments in there. And again, related to Bras for the Cause, decreased funding for Wise Woman and Komen. And the HUD-led abatement control program decrease, again, partial year due to that federal grant, and then workman's compensation insurance decrease. Upcoming opportunities and considerations near term, we are adding a regional healthcare coalition public health emergency preparedness coordinator. It's a really long title, but this is a 100% grant-funded position. It had previously been held for this 10-county coalition in Dallas County. Mandy and Franny, that position, Lynn Royer, who had been in that position, took a full-time position with Dallas County in anticipation and, I say, concern about maybe some local public health regionalization. We held that position open. Mandy and Franny covered that, and we are going to be adding that position and housing it in the Polk County Health Department. It makes sense to have it there. We will be expanding our harm reduction lockboxes. We were denied a grant from the Department of Public Safety, but we did include expansion of lockboxes in our STI HIV prevention grant. So we will be expanding those harm reduction lockboxes. Our first location will be downtown public library. Their social worker is very enthusiastic, and we've begun doing some monthly STI testing and HIV testing down at the library. So that's a good addition. Gun safety PSA campaign, again, we applied for a grant from the Department of Public Safety and were denied that. We are beginning to work again with some local partners, exploring funding options for that through United Way, Mid-Iowa Health Foundation, and others in light of what has happened in Perry. It feels important, but if we don't get funding for PSAs, we will continue our grassroots effort and outreach around gun safety. And then an exciting new addition to our department, we will be providing immigration physicals on Tuesday afternoons. Dr. Alarcon, who is our medical director, had been doing those at Mercy One in his clinic. There have been some changes there. His clinic is closed. New clinic location is not interested in providing those immigration physicals, but we will do it at the health department. So we look to start those in February.
Just 1 day a week?
1 day a week. He's coming in on his day off to do them in the afternoons from 12:30 to 4:30. And maybe some opportunity to expand that, but he's a civil surgeon and certified to do that. So that's a great service for our community. It's much needed.
Helen, before you move on.
Yes.
On the Regional Care Coalition Public Health Emergency Preparedness Coordinator.
It's long. It's a
yeah.
long title.
And you want to hire that position, so, you know, there's talk about the state and the public health system and all that. So what happens when if we hire this person and the state takes us over, what do we do?
It's 100% state grant funded, so if the state takes the funding away, the position goes away.
Okay? So that person's going to have to know that.
Yes, and it's posted as such, as a 100% grant funded position.
Okay?
And we have, what, 19 applicants?
33.
33, it's,
Yeah,
okay.
we closed yesterday.
And this would be the person that would be doing the planning for the next pandemic, the next crisis that we have coming up that
Yes.
we can't see today, but we need to be prepared for.
And exercises and drills, and it's for a 10-county coalition. So Mandy currently serves as the fiscal agent for that coalition from the state, and this will house that coordinator at the Polk County Health Department and allow much better collaboration between the two. And should they make changes, it makes more sense for that position to be housed in Polk County for continuity versus a smaller county.
Yeah.
And if that funding goes away, then the position goes away.
Okay.
We've had some discussions about sometime this year, probably later, a tabletop exercise on water. Should we face water emergencies, that's the type of work this person be engaged in.
Yes, person will be engaged in those kinds of activities. Yep. And doing regional planning. So it's important. We have lots of plans that affect counties, agreements, how do we coordinate EMS, all of those things. So that's what that position will
Helen, I
do.
got a question for you. You got under grant adjustments, you got $192,000 negative here. And I believe you said that the Wise Woman part of that was $90,000.
Yes.
I'm just thinking out loud here, I guess. Do you feel, what was that program doing, Wise Woman? What was that all about?
It was a subset of women that are served in our breast and cervical cancer screening program that would qualify for some, I call it cardiovascular metabolic interventions. So we would test their cholesterol, test their blood pressure, and then provide them with health coaching. It also provided access sometimes to YMCA memberships and other things to help improve a healthy lifestyle. And that's the funding that has gone away. We're still doing the breast and cervical cancer screening.
So the primary set's still there, the
Yes.
subset isn't.
It's a subset of those, of the breast and cervical cancer screening women, smaller group of them that might qualify for cardiovascular interventions.
So that was something we just wanted to do, would that be worthwhile?
Yes. I mean, there's some paying for, there's some expense involved in that in terms of, YMCA memberships, doing the testing and the screening. We still have the staff available, and the staff is in place that was doing the health coaching. We have started to do some outreach to Our Lady of Americas because we have said, just because we aren't getting funding from the state, how can we provide some of these services using existing staff
Right, that's
through a
what I- that's kinda
relationship
what
that
I'm
we have?
wondering. That's kind of what I'm wondering.
Yes.
So we turn back federal dollars to help the women once again. Is that correct? Is that what you're saying?
Yes.
This, because the state didn't apply for that.
The state did not apply for that.
It takes a state, it's required that the state apply, the county can't apply.
Poor people?
Well, the county could just pay it, right?
I don't get it.
Yeah. I don't get it either.
I think we should definitely, I think where he's going, I'm hoping where you're going, is that we want to help and do what we got to do. So the screening and all the additional stuff we want to do, whether they care about the women or not.
Okay.
I'm not sure why they don't. And then the wellness piece of it, I would imagine that's the, you talk about the why, memberships or whatever. I mean, somewhere we ought to cut the deals with the why. I mean, they kind of owe us. We should figure that out.
Okay.
So we need to talk more about it.
All
That's where I
right,
was
we'll
going
take,
with
we'll
that.
take,
That where
we'll
you're
take
going?
that.
Yeah, pretty much. I think these are pretty nominal numbers for us.
Well, for
$90,000.
$90,000.
Yeah, in that case, I don't want to get in the way of, the Broads for the Cause and Coleman and all that stuff. Maybe that's something we need to take a look at too. I don't know.
That's a
That's
separate.
different.
Yes.
Different, I see, but as part of this grant reduction piece you
Yes.
put out there.
The biggest piece of the grant reduction is the $90,000 that was Wise Women funding.
Yeah.
Which is the cardiovascular funding, yes.
Amazing.
We will take that as a to-do and go back and explore what we can do and put some numbers in a budget to that and bring it back to you.
Yeah. Of course, we got to get that past the budget queen over here, Deb.
Okay. We can do that.
Okay.
We can do that. Long-term, again on our list, a legalization of fentanyl test strips And I will say that I've had some conversations with Representative Forbes. He is drafting language to put forward a bill. He's having conversations with the Department of Public Safety. It sounds like the head of the Department of Public Safety may be one of the roadblocks that we have, but we've provided him with some background and some information on why this would make sense. We've asked that the bill maybe be drafted a little more broadly than just fentanyl test strips, because there are also test strips for xylazine, the animal tranquilizer, and other things. So if we're going to do the work to get some legalization for drug testing strips, we want it to be as expansive as possible. We are in the process in 2024 of conducting our community health needs assessment and developing our health improvement plan. We do this in collaboration with the health systems, Mercy One, Unity Point, Broadlawns, United Way, Polk, Dallas, and Warren County Local Public Health, and Mid-Iowa Health Foundation. It has been a community collaboration for really the history of this, and so that will be ongoing. We'll be launching surveys in conjunction with them in March, and the exciting thing compared to 2021, which was really immediately post-pandemic, we were unable to host in-person, in-depth community conversations with underserved individuals and communities in our county, and we will be doing that this year. So we're putting together a plan to do some targeted outreach and provide some more in-depth conversations.
So Helen?
Yes.
While you bring that up, Mid-Iowa Health, those are the folks that we've targeted and given money. They're actually targeting and gotten a group of folks to see, you know, what their poverty level is and what they can do.
Mm-hmm.
And once again, I guess the state there's a bill up there that they want to take that money away from those people. Would that be kind of the folks that maybe you want to talk to? Because they've targeted, you know, that's a level of income, and I would imagine they need our help. That's why they've targeted them.
Yes, absolutely. We would like to hear from them. We're also going to be doing some work with MOC and the refugee and immigrant community to hear their concerns, Corinthian Baptist, Our Lady of Americas for the Latinx community. So we're trying to put a fairly
Robust
effort out there
Okay.
to do some outreach. And we really, those conversations will focus on what we call social determinants of health. You know, what are their barriers to care? What are transportation barriers? What access to food insecurity, those kinds of things, and housing. So it will go deeper than does the actual survey.
Thank you.
And then long-term, one of the things that we are monitoring is the local public health regionalization. And I don't know what else to say about that. We're monitoring it. We're working with Amy Campbell. We're trying to stay on top of it, watching very closely what happens with behavioral health and disability services, and figuring that's going to be the playbook for how they may advance it with local public health.
There's no existing bill in session yet?
No, and I think we've been told by both the state and confirmed with Amy Campbell that there will not be any local public health regionalization legislation this session, but it'll be coming next year, would be my
They
guess.
got a lot on their plate right now destroying us, so I don't know if they could take another one on.
Yeah. And, you know, that's all state funding. Ours is much more heavily weighted with some, you know, county funding supporting local public health, so we'll see. More fun to come on that one.
Yeah, that's the creation of these ADRCs, the Aging and Disability Regional Centers. I don't know that you could slip through that vortex or not at this point, but, you know, I think long-term, this could turn out okay. But I think if it gets too big, it'll be a problem. But we'll have to keep an eye on it, like you, have to monitor it and see where we're going with it.
I think probably one of the big questions I've had from the beginning of this, when they started having conversations with the consultant, is what services do you think need to be provided uniformly across the state? And we've not received any information or answers to that. You know, so I'm not sure. Of course, as in Polk County, we would like to retain some autonomy to be able to do the important things that we have targeted for our community, including, you know, fentanyl test strips and
Right.
that kind of
Well,
work.
that equitable treatment of people across the state is a good goal. I don't know how practical it is, really. You need to get right down to it. I think our our vision of what people need to have for, or what they should have for healthcare, and whether it's behavioral health or healthcare. And here in Lynn County, for example, are probably a lot different than they are in, maybe much smaller counties, for example. So I don't know how practical some of this stuff is, but we'll see.
Yes, yes. Recent accomplishments, we replaced our electronic medical record system. The one we had was out of date and no longer supported, so we successfully transitioned to that. We will be, or we have eliminated, I guess, finally, PrepMod. PrepMod is gone. We can do all of our appointment scheduling and patient portal through this new electronic medical record system. Want to thank TJ and the IT team for helping us navigate that. That's a big project to be able to successfully do. We implemented this last year, video direct observed therapy for tuberculosis management. That keeps our nurses from driving so many miles. I mean, that's actually a process where we are required to watch people take their tuberculosis medication. And with patients that can handle the technology via a cell phone, they can record a video, upload it. It can be very, very convenient for the patients and for us. We have, for example, one patient that's using the video DOT who is a construction worker, and it allows him to stay on his job and work even outside of Polk County and still be able to successfully complete his treatment. So that's a great thing. We completed our after-action report for our COVID-19 response and have that published report and working through the highlights of that. One of the items in that after-action report was the establishing a healthcare coalition in collaboration with EMA. Laura Kaser is hired as the coordinator for that, and Franny is currently transitioning our medical coordination center and that work into this broader healthcare coalition. The healthcare coalition will start to include pharmacies, nursing homes, long-term care, EMS, a much broader focus than the more narrow medical coordination center. We completed our community health worker demonstration project with funding from the United Way of Central Iowa and learned a lot of things about what works and what doesn't work with community health workers. We launched our gun safety campaign, Talk It Up, Lock It Up. That's ongoing. And then finally, in July, we established our home health care services funded by Polk County. That's where we flipped our checkbook and took $300,000 that we've been using in state funding and are now using Polk County funding instead.
Helen, are we going to get the community health worker demonstration project report, or did we?
I can send it on, yes.
Okay.
And we are also giving a presentation on that at the Iowa Public Health Association statewide meeting in March. And it was a good project, and we learned some things very similar to what I'm hearing in this intern project, that we learned that we need to do a better job of talking through what it looks like to show up, what happens when we don't show up. Some of those, I'd say, kind of soft employment skills. Many of the individuals that we had and were utilizing as community health workers also have other full-time jobs. And so we learned some good things about that. But we also had some good impacts in the work that we do, particularly at Our Lady of the Americas. That group is still continuing to meet, and they're doing some work around communication skills and mental health resources and counseling there.
So would this be a lot of the work that we did during COVID too?
Yes, it was an expansion of that, because we did use community health workers during COVID to educate communities about both the COVID-19 virus and then the vaccines. And because we had success with that, we wanted to learn how we could expand upon that and do a better job of building bridges and delivering information and care into communities.
Okay.
And then there are the recommendations.
Yeah.
Yeah, the only thing I think we need to look at is the grant.
Right.
You all okay with that?
Definitely.
We're finding a way to backfill, continue that one program.
Yes.
Yeah.
Okay.
Yeah.
To give us.
I think, I'd like to know the number of people that would, that access that,
Yes.
Just give us some data on it, and then we'll take a look at it, if you could, that'd be great.
Basically, those services will go away, right?
Yes.
We don't do
In their
anything.
current form.
Yeah, we don't do anything.
Yes. They go away, but we have staff and things in place to be able to quickly re-implement those, should you choose to.
All right.
Okay, thank you very
Thank
much.
you.
Okay, Kimberly, you're up, county attorney. I cannot believe. Only saying that she just turned back this money on. Honest to God.
It's a lot.
Do you have a list somewhere?
All the stuff we've turned down.
In the state?
Or not, you've not applied for.
Because I think Laura said.
Access it, or some of it at least. And this, we can't access any of it.
I know,
You turn back, you're just gone.
gone.
I got a theory why they're doing that, but I don't know if it's right or not.
Well,
Housing and climate, those were eligible. Well, the other governments could get,
right.
but as you know, food supplements only, legislation only authorized in
State.
I don't know about this.
Okay,
Okay, good morning.
good morning.
My name's Kimberly Graham, I'm the Polk County Attorney. I just want to start out by thanking the board for your support and your patience over this last year as the office transitioned, made a pretty significant transition after 32 years under other leadership. I'd also like to take this opportunity to thank and acknowledge John Sarcone for 32 years of leading the office, for all of his service to Polk County, and for hiring the amazing people that I get to work with today. So I just wanted to acknowledge that. So, let's see if I can not mess this up. Woo, okay, so, I did it. So, for our budget request, we have estimated revenue of $2,978,000, requested expenses, $20,627,000, current full-time employees, 127.8. The amount by which our expense request is over target, which includes decision packages, $376,000. Our fiscal year 24-25 revenue estimate, our revenue increase compared to the current budget is $20,000, and those changes involve child welfare mediation contract, some increased fines revenue, and anticipated DHS-LAE reimbursement, which is a federal reimbursement because of the new juvenile courtroom, and we hired 2 additional juvenile attorneys to staff that courtroom, and we get some reimbursement from the feds for the juvenile work that we do. So the expense request, the increase compared to current budget is $1,522,000. The bulk of that is for personal services, base wage increases, step and merit increases, and increased benefits cost. We have miscellaneous adjustments of $3,000, and then the decision packages. Our decision packages, I've requested 2 additional legal assistants, and I believe you've all seen the written narrative justification for those, so I know you can all read perfectly well, so I'm not going to bore you with those, but if you have questions, feel free to ask, of course. $22,000 for victim offender dialogue program expansion, and requested a social worker as well. Our recent accomplishments, and I again want to thank the board for your support, because none of this would be happening without your support, so I appreciate your support of our office. I also, this is not in this slide, but I also wanted to thank Ralph Marasco and Mary Culver especially. This is not something we unfortunately left off our slides, but it's certainly a huge accomplishment, and that was helping to obtain the titles to over 70 group homes back to Polk County. So that was huge, and unfortunately didn't get in here, but I wanted to make sure I mentioned that. In addition to that, of course, a lot of these were heavily covered by media, so I'm sure you're all familiar with them. We completed numerous high-profile cases in the past year. We made major changes to the license reinstatement program to make it more affordable for people. We implemented an income-based sliding scale so that we could expand access to that license reinstatement program, and that enabled a lot of people to get their driver's licenses back, therefore decreasing arrests and people in jail because of driving illegally. And since those changes were made, we have increased the number of people in these plans by 77% over the last year. So it really has made a major difference, and I'm so pleased about that. We initiated a policy to request from the judge that people charged with nonviolent, low-level offenses that don't have a named victim, that those people be released from jail on their own recognizance and not be required to post bail. And I'm really pleased to report that the majority of time when we request that, the judges at the jail have been doing that. So we've been able to help to decrease that jail population a little bit, also saving Polk County some money.
Kimberly, I got a question for you. On that one, you say that there's no victim and low-level offenses, nonviolent, blah, blah, blah. What kind of crime would that be? I mean, give me an example.
Justin actually wrote the memo on that, so I'll let him.
Misdemeanor possession of controlled substances, criminal mischiefs that don't have a identifiable person victim, low-level theft cases if there's from a retail shop, usually not. So the cases that are excluded are, say, harassment, assault. If there's an identifiable person that's a victim and we need a no-contact order, they have to see a judge and post a bail.
So I assume that you're kind of tracking how this goes, right? I mean, somebody who gets released on their own recognizance, the concern is that they're going to commit other crimes, right?
Right.
Is that happening?
Yeah, we don't have any data to share with you today. It's kind of tough data to track because what we can track is if they show up for the next court dates, and we haven't noticed any significance in failure to appear or anything like that. Hopefully soon we'll have more global data on what you're asking about if they commit new crimes and recidivism. Anecdotally, I can tell you that it's working really well.
Okay.
Haven't had any alarms raised to us from the judges or anyone else.
Great, thanks.
Because they would not, if they thought there was a problem, they wouldn't let them out.
That's correct. If they thought this program wasn't working or people weren't showing up or committing more crimes, they would definitely let us know.
Right.
Yep, absolutely. So recent accomplishments continued. We engaged with the Department of Justice in their Justice Counts initiative, and that just simply means that we're providing some of our data that we do have to a national database to inform policies and programs nationwide. And the Department of Justice has kind of gone out in communities across the nation and asked local county attorneys to report their data, whatever data you can have. Unfortunately, our JD case management software is not the easiest to mine data from. To be blunt, it's a very outdated, very clumsy system, and way down the road, in better times, I would like to talk about replacing that, but that's not going to happen anytime soon. I'm well aware of that. But it is just a very cumbersome program to try to pull data from. But the data that we do have and the data that we're able to get from Ann Sheely at Court Administration, we are providing to this Justice Counts initiative to better inform policies, data-driven policies across the nation. Additionally, we started a new victim impact class that runs, throughout the year. When one ends, we have another one running. This is to help make defendants aware of consequences of their crimes. We've also implemented a simple misdemeanor diversion program, and that victim impact class is a requirement of that diversion program. I reached out to all the chiefs of police and the sheriff, and I've met with every single one of them twice in 2023 just sitting down and talking to them one-on-one. I think that that's just really critical for us to work well together, and we have to work closely together. And so I've really made an effort and will continue to do that throughout my tenure, to meet personally with the chiefs every year, at least once a year, because there's just things that sometimes we don't have the opportunity to sit down and discuss. And so when I go and meet with them one-on-one, I'm able to discuss things with them. And I'm also able to kind of elicit their thoughts about things that I would like to see going forward, some of which I will mention here in another slide or two. We've also really increased dramatically our community outreach. This office typically, traditionally, has not really been a big presence at a lot of community-type events. And we have in this past year, we participated in things like Senior Fest, Juneteenth, other community activities, and also outreach and education. We've also contacted a lot of the immigrant and refugee organizations and invited them into our office to have a meeting just to discuss with them the issues that they see when their folks encounter the criminal legal system, and how we can help educate their folks. Because a lot of times, sometimes the immigrant and refugee populations have very, very different laws where they came from. And so it's helpful for them to know what the expectations are here. On more recent accomplishments, in March of 2023, we launched the marijuana diversion program. In calendar year 2023, so March through December, about 260 people successfully completed this program, and their cases were dismissed after they obtained a substance abuse evaluation, complied with the recommendations of that evaluation. So this program holds people accountable for violating the law and focuses on treatment and recovery, thereby saving the county money by avoiding continued prosecution and future criminal activity. And we are, again, this has only been since March of last year, so we don't have a lot of data, but so far the data we have is very positive that those folks are typically not getting into trouble again, at least in the limited amount of time that we've had the program going on. I've also really started focusing on our youthful supervision program that was formerly called YOP, or Youthful Offender Program. I have been sitting in on those staffings with these young folks and realized that one of the biggest problems with, the challenges that these young people are having is in finding jobs or keeping jobs, et cetera, around working, and they have to have a job to be in that program. So I was fortunate that I made a connection at Iowa Workforce Development, and this person came to the staffing and was able to directly engage with our young people. We were able to make appointments for these young people to go meet with her. They have all kinds, as you all well know, of job training and other kinds of programs, Learn to Earn, where they've got paid apprenticeship programs for these young people. So we not only want to get them jobs now, but we want to find out what do they want to do with their lives, right? And give them real hope for the future, and then get them into onto a path that's going to lead them beyond just the job that they need right today to get some money in their pocket and actually get some kind of career down the road. So we've been really excited about that, to be able to connect those people. And a particular staffing I attended a few weeks ago, I think this is just a good story about how when we look for opportunities, we've got a lot of opportunities, but we have to be able to connect the people with the opportunities, right? And that's sometimes the missing piece. We had 5 young people in that program who were, the prior staffing, it was discussed that they might send those 5 young people to jail because they hadn't gotten a job yet. And when I brought this person in to talk with everyone, they all made appointments. They all showed up for their appointments. They all did what they were supposed to do. And they're starting to have a really good relationship with the woman that works for Iowa Workforce Development. And we avoided sending those 5 young people to jail. So that saved money, saved jail time, frankly, saved the trauma of those kids going to jail for a day or two because they hadn't gotten jobs yet or hadn't kept the jobs they had. So I'm really excited about what we can do moving forward with the Youthful Supervision Program. We've also engaged with several community groups and agencies. I've listed them there just to better collaborate and improve outcomes for Polk County youth. I'm on the steering committee for the Safe and Thriving Youth initiative that United Way has been leading since January of last year, and we've been making a lot of really good progress in that committee. And then just most recently, we had a social work intern approach us about doing an internship in our office, so she just started a few weeks ago. We are kind of starting a mini version of what they have in Story County, which is called Alternatives. seeking to connect people that have low-level nonviolent charges with services and support to reduce future criminal activity and create a healthier, safer Polk County. And in Story County, for people that complete that program, the recidivism rate is 8%. For non-completers, their rate of recidivism is 48%. So I'm really excited about what we can do moving forward, using Ashley Harvey as her name, our social work intern. And that's an unpaid internship, so it's not costing us any. She has to do that as a requirement to get her master's degree in social work, so she's putting in her hours through our office. And then, where are we? Near term here. Near-term upcoming opportunities and considerations. We're going to continue working with that Justice Counts initiative and providing them the data that we have. We are going to continue to try to serve victims better by expanding our policy wherein people who commit certain crimes must participate in a victim-offender dialogue. If the victim declines to participate, which is not infrequently the case, then a community volunteer surrogate member will sit in the place of the victim in that victim-offender dialogue, so that the offender still has to have a conversation about the impact of what they did. And we have already recruited and trained several volunteers to serve as surrogates and facilitators. I know most of you know Fred Van Loo, who was with the office for many, many, many years until his retirement, and he has now spent, in his retirement years, he's now a consultant for restorative justice practices across the nation, and he's also someone that we're consulting with and contracting with to restore and really expand our restorative justice programming, and these victim offender dialogues is one of those. And then we're continuing the transition of our digital evidence management to Axon. That is a management software where we can then upload all of the video, which I'm sure y'all are aware that pretty much there's cameras everywhere all the time nowadays. Therefore, we have video of just about every crime, you know, if it's anywhere in the vicinity of a camera. And so that just requires a lot more video that we have to look through, that our legal assistants have to look through. Sometimes we're looking through 2 hours of video for 10 minutes or 2 minutes of activity on that video. So sometimes we have to look through quite a lot of it. But Axon is really going to help us with that. And it also makes editing super easy so that we can create exhibits for court. I also wanted to mention, this is not on the slide, somebody mentioned the Project Iowa interns earlier, that actually tomorrow I'm meeting with Chris Noth at Project Iowa about the possibility of an intern that they would fund coming to our office fairly soon. So we're hopeful that we may have that happening. Additional opportunities in the long term. And this one I've already discussed with all the chiefs of police and with the sheriff. They have all stated they're very much in support of this. But to do it in a really sustainable way, you know, it's not going to be just snap our fingers and we instantly do it. It's going to take some time. But there's a program called LEAD, which stands for Law Enforcement Assisted Diversion. That's a nationwide program. It's in a lot of jurisdictions across the country successfully already. And it's not too unlike the Story County program that they've just established locally, the Alternatives program in Story County. Essentially, it's where law enforcement, at their discretion, can refer someone to the LEAD program or to our intern, et cetera, instead of arresting that person. For example, if somebody continues to have a public intox, you know, issue, right? Instead of continually taking them to the jail, lucky for us, we're going to have the sobering center, but we still don't. We will, but we don't yet. They can have the opportunity to refer that person over to a LEAD social worker and then get that person completely out of the system and maybe never have them have to go to the jail, just avoiding a lot of expenses on the other side. So I've been in touch with the national folks. I've talked to the chiefs, all the chiefs in Polk County. I've talked to the sheriff. They all have expressed their, you know, verbally, yeah, that sounds great. We would love to arrest fewer people. We would love to help people with treatment and with things that they need. So that's really a longer term project that we hope that we can eventually implement here in Polk County. We'd also like to develop ways to expand our collections program, which, as you all know, is very successful and generates in excess of $1 million for the general fund annually, and also provides restitution to victims. And we'd also like to see how we can continue to increase access to our license reinstatement program. And specifically, I think still a lot of folks in Polk County don't know that now it's a lot less expensive, and so that they think in the past they couldn't afford it, they probably can now. So we'd like to continue to get the word out about that. That will also, you know, end the cycle of arrests and increased court debt for folks that are not driving on a legal, valid license. And then lastly, and I've already discussed this with Rich Westfall, who's the U.S. Attorney here in the Southern District of Iowa. We've started discussing a program called GVI, which stands for Group Violence Intervention. That is the only program that I'm aware of, and I'm a big stay up way too late researching this kind of stuff and nerding out on it. This is the only program that has been proven to reduce fatal and non-fatal shootings in every jurisdiction that it's been implemented in. This would not be brand new to Iowa. They've had it in Scott County and Davenport for a while. They have it in Minneapolis. They have it in St. Paul. They have it in, you know, a lot of jurisdictions across the nation. And it's reduced fatal and non-fatal shootings in every jurisdiction where it's been implemented. And it requires the collaboration of law enforcement and community members. And I'm really excited about bringing it here, and it is a huge part of the Safe and Thriving Youth initiative that United Way has been leading since the beginning of last year. That is all driving toward introducing GVI to Polk County. So we're moving down that path, and we're hopeful that, you know, maybe within a year, 2 years, we'll have that really up and running and in a robust way here in Polk County. Mr. Norris.
Wait, I have a question.
Sure.
You know, the city's been working on this youth gun violent,
Cure violence?
whatever.
Yes, yeah.
And they've had a program also, I thought, they've been meeting with, I don't know if it's a United Way or not, but what's the difference between what you're doing and what the city's been doing?
Yeah, they're just very different programs. Cure Violence, in a nutshell, I'll try to do it justice. Cure Violence is a more, what's the best way to put it? More of a, No, more of a community-based, street outreach-based program.
That a KO's program?
Yes,
Yeah.
that's Creative Visions. Yes, that's what they're doing, is the Cure Violence
Okay.
program. GVI is a much more law enforcement-focused program. And I'm going to try to chime in if I'm not characterizing this right. I'm going to try to sum this up in like 3 sentences. GVI essentially requires various stakeholders and community members, like my office, the police department, maybe a pastor from this young person's, a church in this young person's area, maybe someone else that this young person already has an existing relationship with. When they find out, and it's not too easy or too hard to find out, it's easy to find out. When they find out that there's something about to go on, or there's some conflict arising, there's chatter on social media, there's chatter among people that there potentially is a bad thing about to go down, they will literally show up at that young person's home, uniformed law enforcement, knock on the door, hey, we are here, I'm here with your pastor, your teacher, your friend from down the block. We're here to tell you that we love you. We want you to be safe, and we want you to be out of prison, and we want you to have a good life. How can we help you?
But
And it may sound completely
makes total
silly and
sense.
simple, but it works everywhere that it's been tried.
That's what Cure Violence supposedly does. They hear all that chatter going on in
They
the
do, but they
streets.
don't have a law enforcement. For Cure Violence to involve law enforcement to that level, it would, and it does, and it would make it so that those people who work for Cure Violence, the folks that they need to speak to in the community would probably no longer speak to them.
If they got
Because
an
they
officer
would
involved.
know that they are really tightly involved with law enforcement. So, for example, in St. Paul, Minnesota, I was up there for a conference last summer, and I met with John, I want to say John, it's not Ramsey, John Choi. John Choi, who's the district attorney in St. Paul, in Ramsey County. And I talked to him about GVI because they have it up there. They also have Cure Violence in Ramsey County. And so it's not an either or. I think
both?
you really need both. I think you really need both to be the most effective. And they both have their place, but they're not going to, you're going to reach different people with different messages and with different tactics. But I do know that, I will say, and I don't in no way mean this at all to disrespect Cure Violence, they do a great job, and I think they make a huge positive difference. That said, GVI is the only program that has shown to decrease fatal and non-fatal shootings in every jurisdiction that it has been rolled out in. So I just, as a data nerd, I can't ignore that. And, you know, in talking with Rich Westfall, the U.S. Attorney, with Chief Wingert, with all the other chiefs, they all, in discussing more in depth the program with them, and we did have people come out from Scott County and sit down with Rich Westfall and Chief Wingert and myself and a couple of other folks to discuss this initial discussion, like what does GVI look like? How does it get implemented? What do we need to do? They all believe that they know it works. Rich Westfall's seen it work over in Davenport, and so they're all very excited about bringing it here. But it's not, they complement each other, I would say. I think we definitely could use both.
Okay.
Yeah.
Kimberly, what is your thoughts on the social worker, embedding a social worker into, because it seems like a no-brainer to me because of so many people that you're seeing with mental health and substance abuse issues. Is that kind of where that social worker would fit into the system, and how would it work with your existing structure?
Yeah, so I had a pretty lengthy meeting with Annie from Polk County Behavioral Health because I'm quite pragmatic and I don't want to be duplicating something if someone else is doing it. She has some folks that are helping with kind of jail reentry, which is not exactly the same thing that I would see ultimately down the road a social worker doing from our office. Our prosecutors are in a really unique position in that they are seeing people very shortly after they're arrested and really get a handle on, you know, have the potential to see what is going on with this person. Are they houseless? You know, do they need mental health treatment? Do they need drug treatment? And the problems happen when people fall through the cracks. And some folks are just gonna need way more hand-holding, for lack of a better word, and really ushering them through every step than other people are gonna need. We went up to Story County a few weeks ago. Ashley, our social work intern, myself, and a couple other folks from my office, to just sit with Shelby, who's the one who does their program in Story County, and just hear from her exactly what does she do in a day? How does she help these people? What does she do? It's just super labor intensive because some people absolutely need that. You can hand them a card and say, go sign up for this. They're never gonna go sign up for that unless you literally go with them and sit with them and help them sign up for that. And that can make all the difference. You know, here's kind of a tangential example. I'll tell this really quickly. When I was a defense attorney for 23 years, I had a client, this was maybe 6 years ago or so, really good-hearted, wonderful person who had lost her children. Her children had been removed from her care because she was addicted to methamphetamine. She was also depressed. She also had a lot of issues. She kept not getting her substance abuse evaluation. And that was one of the things she had to do. That was like the first step to get her kids back ever, to even have a chance of it. And one day I texted her. Did I have to text her? I was her defense attorney. I didn't have to text her. But I texted her and I said, are you home right now? Because I think I had a hearing cancel and I didn't have anything that I needed to be at for a couple of hours. She said, yeah. I said, stay there, I'm coming to get you, I'm taking you to House of Mercy, and you're gonna get your damn substance abuse evaluation. I did that, and thankfully she followed through with the recommendations. Long story super short, she got her kids back, she's been healthy and sober ever since then. I have lunch with her sometimes now, these years later, she's still doing well. And, you know, I'm not saying I'm so great, I was just doing what I thought another human being needed, and she's told me more than once, Kimberly, you saved my life. That's the kind of thing a social worker can do, is when there's a gap, when there's a crack, and there's no one else there who's gonna say, I will take you, I will sit with you, I will do this. That's what a social worker can do. And as one social worker, you know, it's kind of the old starfish story. You know, you go along the beach and you throw back in starfish and somebody says, well, you can't save them all. And you can say, well, I saved that one. I mean, we have to do what we can, you know? So that's going to be, I think, what's going to be so great about having a social worker. Another quick story, and then I'll wrap up. In December, a young woman, a 20-year-old autistic woman, was murdered in the Econo Lodge by the state fairgrounds. I'm sure you all heard about it. She was in the Polk County Jail for 3 months for low-level nonviolent charges. The reason she was in the Polk County Jail for 3 months for low-level nonviolent charges was because her defense attorney, who is a great guy who I've worked with in the past, knew that she would be safe there. She told him she was being trafficked. I don't doubt that was true. She was very kind of naive. You know, her autism kind of made her especially vulnerable. She was 20 years old. She was homeless. And she was at least safe in the jail. And I've talked to her mother since her murder. And she said that she was actually pretty happy living in the jail because she had a place to be, she had structure, she had kind of made some friends in the jail. It was actually structure that she needed. I mean, how sad that that was really good for her, right, being in jail, but it was. And her attorney, Austin, her defense attorney, was doing his best to protect her. She was murdered within a week of getting released from the Polk County Jail.
Murdered in the jail?
No, at the Econo Lodge by the fairgrounds.
A week after she got out of the
Oh,
jail.
after she got out of jail.
A week after she got out of the jail. And it was kind of like, they couldn't really keep her in the jail much longer. Somebody, I believe it was from CSA, actually came, drove her from the jail to the downtown homeless shelter. That was the only place she could go. She met someone there who murdered her. Why we are releasing young, vulnerable women to the homeless shelter is beyond me.
Well, that's a whole nother story.
It is a whole other story. But our prosecutor, who also was aware of this woman's issues and limitations and autism and everything, was doing her best as well. Her defense attorney was doing her best. Our prosecutor was doing their best to call everywhere and try to find a residential facility for Alyssa to be released to. Nowhere in the local area would take her. Primarily, a few of them said because of her autism. Well, she's never going to be fully sustainable on her own, and we only take people who can be fully sustainable on their own. So it was just this gap, this huge gaping hole, right, that there was nowhere for her to go. And can I swear that if I'd had a full-time social worker, I could have found her somewhere to go, that our office could have? No, I can't guarantee that, but it would have given us another shot, maybe, at that. Because our prosecutor didn't have anybody like in office to say, hey, we have this person, we think this person's at risk once they get released from the jail. What do you got?
Why
What-
wouldn't you
what
call
can we
Annie
do?
on that kind of thing?
You know, it's interesting, talking with Annie a couple weeks ago, we talked about that case, and I'm fixing it. I think that was just an issue of ignorance on the part of our prosecutor. The prosecutor is phenomenal, who was working on that case. Annie expressed to me that there was a history of her offering to educate the Polk County Attorney's Office on a lot of things she had to offer, and that wasn't very well received. There wasn't a very good relationship between Polk County Behavioral Health and the Polk County Attorney's Office, is what Annie's communicated to me. So that's changing. We're having Annie come out in a couple weeks, twice actually, to have all of our prosecutors and all of our staff sit and hear from Annie everything that she has to offer, so that that at least doesn't happen again, that somebody doesn't contact Polk County Behavioral Health because they don't know what's available there. So again, it's a matter of, we might even have some services, but we're not talking to each other. So again, it's a matter of, we might even have some services, but we're not talking to each other. And I hope, and my goal is that I'm connecting our office with a lot of different other parts of the county, that we all need to be connected. And as we all often say, stop operating in silos.
Right.
Yeah.
And I guess the other question I would have is, if you're gonna have an intern as a social worker, could that intern maybe find the number of lower level offenders before pre-trial release, so we can kind of get a number of what maybe we are looking at? Yeah, how many are those, you know, because I think Frank mentioned he didn't think many were falling through the crack the other day when he brought that up, but.
Yeah. And
think
in
there
numbers,
are?
it may not be a lot of high numbers, but it'd be good to know. Yeah.
Right, it would be good to know, if she can collect that data so we can see, is there really a high number of people like the gal that, you know, stayed in our jail for 3
Yep.
months that could have had some
Alyssa
access?
Mayer is her name.
And you know, and I'm sitting here thinking, you know, we just met this morning, accumulated with CJCC, you know, I think that was always the initial intent when we started doing the Criminal Justice Coordinating Council, was to stop operating in silos, so we could all be at the table and have that discussion. I wish they could have heard that story. The people at the table, you know, need to be able to talk to each other all the time, just so that we can provide, because there had to be something else available for that young lady. It's a terrible story. Somebody would have had ideas that wouldn't have had her in a situation where she lost her life. But anyway.
Yeah.
Well, I mean, thanks for both the background on that too, Kim, and that was our concern in looking at this is, if you have, or how does that solve the lack of integration with Annie's shop? And should that social worker be in the county attorney's office, or should it be someone from Annie's, or Eric should be involved in this too?
Right.
To discuss how we have a seamless handoff. And is it this, and so we were cautious to say, okay, the solution is the solution really just a new social worker?
Right.
It's accountable to you in the county attorney's office, or is it coordination with Eric and Annie and you to make sure that this hole gets filled?
We have social workers. Eric's got social workers. Annie's got people in there that can help. I mean, there are people in our world that can help if there's, you know, not a huge number in jail that are in that lower level.
Yeah.
But, and maybe there's more that you want out of social work. I don't know. What I don't want are people falling through the cracks that are gonna die.
Right.
That's what we don't want.
Absolutely. And I did talk to Annie about that. She can only work, her social workers can only work with people that either have diagnosed mental health conditions or dual diagnosis, so addiction plus
Right.
a diagnosed mental health condition. What her social workers cannot deal with is what I envision down the road, if we ever get a full-time social worker, people whose primary identifiable issue is addiction, is substance use, and they don't have maybe, sure, do they have maybe depression, anxiety, you know, like almost all of us do? Maybe, but it's not like a diagnosed serious mental health issue. It's primarily addiction is their issue. And those, I think, are a lot of the people that are currently could use connection with services, and not just with treatment services, but the things that come along with that, perhaps poverty, perhaps homelessness. And again, we may have all these great services in Polk County, but we don't have somebody really
To navigate it.
helping that person navigate it and teach that person and literally show that person what's available and connect them with that service individually and really and encourage them and support them. You know, sometimes it just takes, like with my client those years ago, it just takes one person, you know, believing in somebody and saying, you can do this and I will help you, you know, and I think that's what that social worker ultimately could be for some people.
You know, so substance abuse part of that is, currently that's a silo right now, the way they handle that. It's not part of behavioral health or anything, it's just a silo on its own. I wonder if they're not able to deal with that at behavioral, Annie's shop, isn't able to deal with that because of that silo. That's gonna change in the proposal that substance abuse
Right,
will fall in.
right.
I wonder if that might change, I don't know if that will or not.
Yeah, it might, which would be great.
They could deal with that, which might solve your problem.
Can we expand Annie's post-booking service program to include these staff people that can really describe it as a counterbalance to if there's more level 4s in the jail, that there's these people who can pull out that
Right.
jail number overall.
Right. And also the whole lead concept, whether we call it lead, whether we formally get lead here or not, or whether we call it alternatives like Story County does. Ultimately, what Shelby's been able to do is work with law enforcement in Story County, so they're not even arresting people. If it's like a public intox, they're referring that person to Shelby, and they're not even arresting them or citing them. They're like, let's fix the issue. Let's not incarcerate them or give them more fines and fees and a ticket for being drunk in public again. Let's
No,
try
we want to take them to the
try to.
sobering center.
Right.
We don't want them to go to emergency room or to jail.
Right. Yep. So that's going to be huge. I'm so excited about that. I can.
Me too.
It's
Going like
coming
bouncing in
along.
my seat.
Coming along,
I
we saw
know.
it yesterday.
Thank you for that, all of you too. That's just going to be huge and such a game changer. So,
We hope so.
yeah.
All right, well, more to come on yours.
Yep.
And Anybody got anything else they want
So
to
you
say?
get one of the two legal assistants, it looks like.
Yeah,
Yeah. I mean,
Yeah.
we, perspective here, countywide, we've, I think 3.3 FTEs is what we, you know, the idea here is limit growth of ongoing expenditures. So countywide, we have a total of 3.3 approved new FTEs, and so we did one for one of the legal assistants. So, yeah, your decision before you now is, do you want to do a social worker, or is there some coordination we want to see, communication with Kim and Annie and Eric, and see what's the best way to solve that piece, and then, yeah.
and I think
is it
the
one or two
intern
legal
collecting the
assistants?
data is a good step first. Let's see how that turns out. And we've got the pretrial stuff to look at. I mean, there's a lot of missing or moving parts
Yeah.
right now.
Yep.
So I think we need to work on all that.
By the way, thanks for talking to the police chiefs and the sheriff. That was a brilliant move on your part. I think they really, really appreciated that, so. good
Yeah,
work.
absolutely. Well, we depend on them, so we need to have good relationships with them, for sure. Thank you, everybody.
All right, thank you.
Thanks.